So with lockdown measures and tighter restrictions, the holiday season will be much different for families trying to celebrate this week, and particularly, it may be difficult for children. Our next guest can help share tips on how to alleviate that stress. Dr. Dina Kulik is a pediatrician, and she is also the founder and director of Kid Crew Pediatrics. She's joining us tonight from Toronto. Thank you so much for being with us.
Thank you.
All right, so on the cusp of the new measures across Ontario, of course, also families right across the country dealing with restrictions, what are the biggest concerns you anticipate for children's mental health?
I think it's hard when we're used to having a certain type of holiday, a gathering, a joyous, cheerful experience. And with these further restrictions, parents are stressed. We can't be with a big amount of loved ones this holiday season. We're used to big family gatherings and seeing friends and family and sometimes traveling. And that obviously is quite different this year, but it can still be amazing and we can still have a really great time, albeit with our household.
Okay, and how do we do that? How do we make sure that our kids are having a really great time?
I think making new memories, making new patterns for them. We may not be able to do the same things as we used to, but we can still do things together with our household members. So creating new, experiences for them. So let's bake cookies for our neighbors, our friends, our family members. Let's make a big holiday meal and perhaps share it with others if we can. Let's, put on new holiday PJs and take a photo. Let's, make some crafts. You can make new games and new traditions with them. And what parents really need to know, I think, is that kids want us. They want us as parents, individual time, lots of one-on-one time. That's what they most value, much more than big holiday parties.
Yeah, that's a great point. The other thing that we've been reporting throughout the night here is that for some kids, the safety measures are going to include an extended school break. In your opinion, what do you think is going to be the impact of that disruption?
I think it depends on the child. Some children are having a really difficult time with being with less peers or being at home more or virtual learning versus in-school learning. And other kids are really thriving because they're getting much more one-on-one attention from parents when that's available. Recognizing a lot of parents are working from home too, and they're so divided in how they're able to structure their day. But kids really want us, right? They want, when I say eyes to eyes, one-on-one attention. And the more we can have fun with them, even for brief periods during the day, knowing that we have all these other things and tasks to do ourselves, the more they're going to value that. And they'll remember the new memories, the new traditions, and they'll be less focused on the previous ones.
Who doesn't want that kind of one-on-one attention? Right?
They do.
Now,
sure.
Dr. Kulik, I'm also wondering, what are the signs that parents and loved ones should be looking for when they're watching for their kids' mental health?
Yeah, very important topic, during this pandemic and always. If your child is retreating to their bedroom more often, if they're less interested in doing the things they loved to do before, of course, within the home, but, going outside or speaking to a loved one virtually or doing a puzzle or playing a game, if they're finding less joy in things they loved before, if they're eating excessively or much less, if they're sleeping excessively or much less, if they seem more irritable, less joyful, sad, anxious, depressed, you do want to talk about that with your healthcare provider for sure.
Okay, and when you talk about those kids who are feeling that stress, feeling that anxiety, what is the manifestation of that on the little bodies?
They can manifest with, actual symptoms that you might see, like, they might say that they're anxious or sad. They might be more tearful. They might really be crying. They might just retreat to their rooms. And a lot of young people will show what we call somatic symptoms. So headaches, belly pain, difficulty sleeping, difficulty eating, a lot of aches and pains sort of presentation, which is challenging because that's also the presentation of many illnesses and many other things. So it's really in collection with all these other symptoms that we want to be mindful. And again, discuss with your doctor to make sure that you're not missing something medical and working through those mental health concerns as well.
All right, great point. One final thought. 2020 has been such a difficult year for so many people. New Year's is around the corner, and many people are going to probably be making resolutions. I guess this is not just for kids, it's for everybody, really. What suggestions would you give people as they contemplate making a resolution at the end of a year really like no other?
I'm all about silver linings, and I share this with my audience and in my newsletter every week. Focus on the positive. That's helpful, right? So the amazing time we get to spend individually with our children, the ability to think through who do we love the most, who we cherish the most, and finding a way to connect with those people. What are the activities we love the most? What makes us feel whole and healthy and happy, and to focus on those things more as we go forward.
Ah, that's great. Okay, and I'm also a sucker for a silver lining, so thank you very much for bringing that one to our attention and for joining us tonight.
Thank you. Stay healthy.
Yes, you too. And Dr. Dina Kulik is a pediatrician joining us in Toronto.